There are certain things that make a person more at high risk for breast cancer than other things. Women with dense breast tissue, they're at increased risk because there is more tissue for the cancer to form in, and it's harder to see. Women who had an early menses, they started their period age 11 or sooner, they're at increased risk. Women who did not have their first pregnancy or have not had a pregnancy, but had their first pregnancy at age 30 or later, or who have not had a pregnancy, they are at increased risk. People who have had previous biopsies, even though those biopsies are benign, they are at increased risk. And then every first degree family member you have increases your risk, and then even the second degree relatives play into that as well. And so we do a thing here at the Breast Center called the Tyrer-Cuzick Risk Score. We figure it on every single patient that comes through the door, and we identify what your risk number is. Even women that are at an intermediate risk, 15 to 19%, we allow them to consider the breast MRI. That's a discussion between themselves and their practitioners. And we will let them get the breast MRI as well if that's something they'd like to do. But definitely anybody over 20% lifetime risk is considered high risk and is definitely a person who should consider getting the breast MRI. If you are high risk, screening recommendations change a little bit from that age 40. In other words, we say start the breast MRI at age 25 and the mammogram at age 30. And then once you're 30, you can do the alternating 6-month program just like anyone else that's getting the breast MRI. But from age 25 to 30, high-risk women, we just do the breast MRI for them because age 30 is the age that we feel like risk and benefits of radiation of a mammogram equal out to where it's beneficial to get a mammogram. And besides that, an MRI is going to detect anything, that's there to be detected. And so having that starting at age 25 for your high-risk women gives extra peace of mind and helps with early detection. Because breast cancers that are diagnosed early, people in their 20s, 30s, and 40s, are much more aggressive breast cancers than those that are diagnosed at age 50 and above.